Okay, we are live now.
हमजा ग्रुप्स में मैसेजेस कर दो जिसमें वो सारे 400-500 पार्टिसिपेंट्स हैं, उसमें मैसेज कर दो कि वी आर ऑन लाइव।
हाँ, मैं कर रहा हूँ।
ठीक है। एंड लिंक भी डाल देना यूट्यूब चैनल का।
Recording in progress.
हमजा स्टार्ट हादिया
जी
स्टार्ट कर दो।
ओके
Kindly begin.
Assalamu alaikum and good evening everyone. Thank you for joining in today. We welcome you all on behalf of Medicos 𝗙𝗧𝗖𝗔𝗟 Rawalpindi Medical University. The title of our webinar is Viral Hepatitis from the Theoretical to the Practical. We would be covering all the aspects of viral hepatitis. The esteemed speakers will also give their recommendations for the viral eradication and elimination. Today, our panel of speakers is comprised of Professor Dr. Muhammad Umar, Professor Dr. Yasir Waheed, Dr. Tayyab Saeed Akhtar, and Dr. Javeria Khan. We are honored to have you all here. The webinar today will be comprised of two sessions. The first session would consist of presentations by the esteemed speakers, and the second one would be a Q&A session in which the speakers will answer the queries. Starting with this webinar, I would invite Muhammad Haris Mumtaz for the recitation of the Holy Quran.
Assalamu alaikum. Am I audible? Assalamu alaikum. Am I audible?
Yes, Haris.
Yes, you are audible.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. يا أيها الذين آمنوا اتقوا الله وقولوا قولا سديدا يصلح لكم أعمالكم ويغفر لكم ذنوبكم ومن يطع الله ورسوله فقد فاز فوزا عظيما. إنا عرضنا الأمانة على السماوات والأرض والجبال فأبين أن يحملنها خلقنا منها وحملها الإنسان إنه كان ظلوما جهولا ليعذب الله المنافقين والمنافقات والمشركين والمشركات ويتوب الله على المؤمنين والمؤمنات وكان الله غفورا رحيما صدق الله العظيم.
Jazakallah for the soulful recitation, Haris. Now I will ask the President of Medicos Aid Society, Mr. Muhammad Tahir Kaunain, to give a brief introduction of our society.
Assalamualaikum. Am I audible?
Yes, you're audible.
Assalamualaikum everyone. This is Muhammad Tahir, final year MBBS student from Rawalpindi Medical University. Currently, I am working as President of Medicos Aid Society. I welcome all participants to this webinar, especially our worthy guest speakers, Dr. Yasir, Dr. Javeria, and Dr. Tayyab. Thank you so much, all of you, for sparing your precious time for us. Before starting the webinar, I would like to present Medicos Aid Society briefly. So let's start. Medicos Aid Society is a student-based, non-political welfare organization. Medicos Aid Society was established in 1983 by our dedicated volunteers. From then, it has been 39 years. So different volunteers are working tirelessly for the deserving humanity. We are the only organization of Rawalpindi Medical University which is registered with Punjab government through a social welfare department. We work under the patronage of Professor Muhammad Umar, Vice Chancellor Rawalpindi Medical University. He is very supportive and kind to us. Our staff in charge is Professor Dr. 𝗄𝗲𝗡𝗅𝗏, Head of Anesthesia Department, Holy Family Hospital. This is our current panel. To manage our vast range of activities, we have divided MES in 5 different sections and a general section to better communication. Starting with the blood section. Blood section provides blood bags to the deserving patients of Rawalpindi and Islamabad. Till now, we have collected more than 20,000 blood bags in different blood camps. We arrange blood camps in different institutes of Rawalpindi and Islamabad and collect blood for thalassemia patients. So we arrange blood bags for the deserving and poor patients in different hospitals of Rawalpindi on emergency basis. In the year 2022 till now, we have arranged 4 blood camps and collected 583 bags. We have provided 139 fresh blood donors in the different hospitals of Rawalpindi, and the donors were from Rawalpindi Medical University. We arranged 2 blood donation drives in Jamila Sultana Foundation and provided 23 blood bags. These are details of our blood camps in different institutes. These are pictures of activities. Coming to the medicine section. Medicine section provides free of cost medicine and consultation to the deserving people in peripheries of Rawalpindi and Islamabad. We arrange medicine camps in different areas, villages around Rawalpindi and Islamabad and provide medicine to the deserving patient. Till now, we have arranged almost 76 medical camps and provided medicine and consultation to more than 1 lakh deserving patients. Assessing the situation of hepatitis in Pakistan, Medicos 𝗙𝗧𝗜𝗔𝗟 started an initiative to vaccinate the students of Rawalpindi Medical University. Till now, we have arranged almost 150 vaccination camps in old and new teaching blocks of RMU and vaccinated almost 5,000 students. We also hold our dispensary in our office of the Medicos 𝗙𝗧𝗜𝗔𝗟 and we provide medicine to the staff and the students of RMU. These are details of 2022. We have arranged 2 medicine camps in Sroba village and provide medicine to 1,371 patients. We arranged 1 vaccination camp in old campus and 1 in new campus and vaccinated total 442 students. We currently we work in collaboration with Holy Family Hospital regarding vaccination. We are very thankful to the medicine unit, Holy Family Hospital, for providing us medicine vaccinations. These are glimpses of medicine camp. There are a few glimpses of vaccination camps in old campus and new campus. Then finance section. Finance section provide financial assistance from zakat to the deserving patient who can't afford their medical expenses. We specifically work for the medical needs of the patients. Medicos 𝗙𝗧𝗜𝗔𝗟 also done audit of the all donations and expenditure on regular basis. These are a few expenditures of the last year 2022 till now. We have almost total expenditure of 8,45,000, of which 6,83,000 were expended to the deserving patients for and lab tests and different procedures. We also donate instrument to different hospitals of Rawalpindi. Last year, we donated bronchoscope in ENT HFH. We also hold a ration drive during COVID. We provided almost 1,700 ration bags to the deserving families of Rawalpindi. The publication section. Publication section highlights the activities of society and generate awareness among community. We have our YouTube channel on which we made videos and posters regularly on the medical issues. This year we arrange a hepatitis awareness campaign. We arrange a thalassemia awareness drive on our social media platforms. These are few highlights of our Facebook page and YouTube channel. Computer section deal with IT related aspects of the society. Computer section maintain online database of the society. They generate presentations. They generate monthly reports, annual reports. Further, they manage and arrange online webinars for the purpose of awareness. Last year, we arranged a webinar on the topic of COVID-19, and more than 900 individuals participated in this webinar. This was the introductory session to the first year of that time. These are few glimpses of our reports. General section. Section arrange our executive body meetings and mainly work for the communication purpose and maintain a healthy connection with university administration and social welfare department. Thank you so much, everyone.
Thank you, Mr. Mohammad Tahir Konan, for such a thorough presentation. We are now going to invite our speakers to share their knowledge with you. Over to you, Hamza.
Assalamu alaikum, everyone. I hope I am audible. If someone can confirm.
Yes, you are audible.
Okay. Moving onwards now to our panel of speakers, inshallah. So the first speaker, inshallah, that will begin our talk on hepatitis this evening will be Dr. Tayyab Akhtar. So I would just like to give a brief introduction of Dr. Tayyab. Dr. Tayyab is a consultant gastroenterologist and hepatologist and a senior registrar at the Center for Liver and Digestive Diseases, Holy Family Hospital. Dr. Tayyab is also a chief medical officer at 𝗪𝗲𝗎4U, American Telephysician Project. Dr. Tayyab is also the joint secretary for the Society of Therapeutic Endoscopy Pakistan and is also a faculty learner at the University of South Wales. So now, without further ado, I would like to pass the mic over to Dr. Tayyab to kindly share his presentation and begin the webinar. So Dr. Tayyab, over to you.
Thank you very much. Thank you very much, Medicos Society, for inviting me on such a very interesting webinar. And after listening to the intro given by the society, it's really I'm very happy to see the work you have done. So on this, although we have just celebrated World Hepatitis Day, you have arranged this webinar on such an important topic. And I think so, without further delay, let's start the topic with elimination of hepatitis by 2030, which is actually the task that has been given to the whole world by the WHO. So if we just look at the international statistics, hepatitis B and C, they are a global, they are global diseases. And from the global perspective, some 400 million people are infected worldwide, making about 1.4 million people suffer and die from viral hepatitis. So this is a huge number. Some 4,000 deaths per day are estimated, and we can yet prevent them by testing, vaccination, and treating the patients in a timely manner. Yet less than 1% of people living with viral hepatitis, they reach up to treatment, and this is a big dilemma. Looking at the Pakistani perspective, we, as far as hepatitis C is concerned, we are facing a big issue. The stats states that if the global prevalence is about 1.6% of hepatitis C, Pakistan is somewhere at number 2. This is a study that was done in 2014, and after China, we have got a prevalence of about 6.7%. Maybe if we find the missing millions, the true number will be far more. China, which has got actually a huge population, that's why I think so they are exceeding Pakistan. But otherwise, it's a huge impact as far as our population is concerned. So a big threat for us. As far as hepatitis B is concerned, quite a high number over here as well, and about 3% of the population is suffering, making about 6 million people. The big problem is that yet a lot of people don't even know that they are suffering from hepatitis B and C, and that requires a lot of screening actually. So that's why actually the slogan has been changed since 2018, that we have to find the missing million. How to screen? Basically, the screening tools are quite simple. For hepatitis B, we conduct a screening test that is known as hepatitis B surface antigen. And for hepatitis C, it is anti-HCV antibody testing. If it comes out to be positive, then the PCR is used to confirm. Now, actually, a few facts let me share with you people, because knowing the risk factors is very important. You as a society is also working on several important aspects within the community. So the mode of transmissions are very important for you people as well. The basic mode of transmission is either through the sexual route or the vertical transmission from the mother to the child, the sharing needles, the blood products, and the needle stick injuries. As far as hepatitis B is concerned, there is literally no secretion in the human body that cannot transmit the virus, like the blood, the body fluids, the vaginal secretions, and the semen. But the vertical transmission, as far as hepatitis B is concerned, has got the maximum rate of chronicity. So that is one aspect that should be addressed with far more importance. The rate of vertical transmission leading to chronicity is as high as 70 to 90% as compared to the rest of the exposure types. The needle stick transmission rate is also quite high, up to 30 to 40% as compared to hepatitis C and HIV. It's also quite high with hepatitis B virus. When we come to hepatitis C, again, the mode of transmission is more or less the same, but luckily the vertical transmission chances are less. Similarly, the sexual transmission and the occupational exposure are relatively less, but the main source is either the blood and the injecting drugs. So the injections and the blood and the instrumentation for hepatitis C, it's on the top. Some 2 million people a year contact hepatitis from unsafe injections. The needle sticks has to be avoided, exposure prone to the infected healthcare workers, and then the sexual exposure. Needles can also be a mode of transmission through tattooing, through body piercing, and through acupuncture. Some other sources might be shaving razors, the barbers. Some debatable sources might be toothbrushes, the spoons, and some still under debate are the human pipes and the high rate among the butchers. But the important point is all these things can be prevented by spreading the knowledge, by generating awareness among the society. As I've just discussed, that vertical transmission in the hepatitis B is very high, and then it leads to chronicity. So this is one aspect where we should be working very religiously, and every child can be protected. And prevention is very cheaper than cure. Very easy algorithm is right in front of you. Don't want to go into the details of this. The bottom line point is that if a mother is hepatitis B positive and she is having some high titers and hepatitis B e antigen positive, we can even start treatment in that mother just to prevent the transmission into the baby because of the higher vertical transmission rates. The baby can be offered the immunoglobulins as well as the vaccination to further prevent this transmission. So this is one area we should be working upon. Then the vaccination, of course, WHO has taken up this very seriously as well. Globally, now it is the part of the regime which is given to the children born in different countries, including Pakistan. Even those adults who haven't been vaccinated can be given this 3-shot course of hepatitis B vaccination, which can be given at any time, then 1 month after the first shot and then 6 months after the first shot. So 3 simple vaccination schedule to those adults who haven't been vaccinated before. Needle sticks, as we have already discussed, so safe handling and disposals of the sharps is very important. Keep your community safe with sharp containing equipment, dealing, and all those protective gloves and aprons and gloves, masks, and all these things. You should be very cautious about those things. Always demand syringe that is sterile, that is not being reused. The equipment, especially the being used in surgeries and in the dental procedures. Make sure that it is properly sterilized. This is very important for especially the students who will soon be coming to the wards and dealing with the patients as well. The resheathing, this is one way, because up to 1/3 of the needle stick injuries occur while attempting the resheathing. So try to avoid this. It's better to for you to take the container to the bedside rather than taking the needle to the side of the container or to cutting the needle. Similarly, by educating the patients not to demand the unnecessary injections, because about 8 billion injections a year are given unnecessarily. शायद पाकिस्तान में तो ये रेट वैसे ही बहुत ज़्यादा हाई है. हमारे कुछ पेशेंट्स को तो उस वक्त तक सकून ही नहीं मिलता जब तक वो injections ना लगवा लें. So this is one thing that we have to teach them, that the pills, they do not transmit hepatitis, but the injections, they can. So this is the duty on our part. But what if you get a needle stick injury? Don't panic, first of all. First aid दें, properly wash करें, flush करें अच्छी तरह water से, antiseptic measures लें. If you are being injected by a patient who was hepatitis B positive, तो अव्वल तो आप सब लोग, जैसे you are doing a very good job in vaccinating the students with hepatitis B. अगर तो आप vaccinated हैं और आपने अपने titers check किए हुए हैं, they are more than 10 international unit per ml, so don't panic, you are safe. But what if you're not vaccinated or you don't even know or don't remember? So here you have to be very cautious. Immediately आपको immunoglobulins लगवाने चाहिए और अपनी आपको vaccinate करवाना चाहिए. Hepatitis C, unfortunately, we don't have the vaccination yet. So first aid के बाद आपको recheck करना पड़ेगा. एक तो अपना baseline करा ले कि पहले से आपको कुछ तो नहीं है. And then at 4 to 6 months पे आप अपनी serology करा सकते हैं. But if you want to know earlier, तो फिर आप 4 to 6 weeks पे PCR भी करा सकते हैं. If it come out to be positive, even then don't panic, because now we have got some very good treatment for hepatitis C and it is nearly 100% curable. A very simple message for going to the barbers, अपनी एक kit ले लें. बहुत simple सी investment है लेकिन बहुत high yield है. तो अपनी kit ले लें और उसी के साथ हमेशा barber के पास उसको लेके जाएं. Ask him to use that on you. Tattooing, these are some unnecessary things which can transmit the virus. To avoid these things as much as possible. आप लोग बहुत ज़्यादा काम कर रहे हैं blood donation के अंदर. Now, so the health of the patient is in your hands. So in this screening, it's your own responsibility. Unscreened blood is unsafe blood. Another big dilemma in our society are the IV drug abusers, because this is one population, one set of population which has got a very high incidence of hepatitis B and C. So, but do not let the stigma kill them. They are also the patients, they are also the human beings, they need your help. If you won't help them, who will? When hepatitis do not discriminate, so why should you? Now just imagine that having a cure for an illness that affects some 70 million people and eliminating a global killer that claims 1.34 million lives every year, and having a vaccine that can prevent some 800,000 lives. This is a big thing that we can provide to the society. So इसी imagination के ऊपर in 2016 some 194 countries they committed to eliminate hepatitis by 2030. और इसी के ऊपर few goals were set. Idea ये था कि annual deaths will drop by 65% and 10 million lives will be saved by 2030. और इसी तरह से people started working on it. एक रेस स्टार्ट हो गई है पूरी दुनिया के अंदर. बहुत से गोल्स अचीव किए जा चुके हैं, कुछ अभी काफी दूर हैं. टारगेट यही है कि बाय 2030 वी हैव टू एलिमिनेट हेपेटाइटिस. बड़ा मसला जो अभी दिख रहा है वो यही है कि हमें उन लोगों को ढूंढना है जिनको भी पता ही नहीं है कि दे हैव गॉट hepatitis, इनका number बहुत ज़्यादा है. Like it is estimated some 9 or 10 people don't even know, जो कि तकरीबन 290 million बनते हैं. So target ये है कि by 2030 अगर हम 57 million undiagnosed Hep C patients को ढूंढ लेते हैं और some 237 million undiagnosed Hep B patients को ढूंढ लेते हैं, so we can really make a big change in the face of the world. So हम लोगों ने, everyone has to play a big role for this. हम लोगों ने रावलपिंडी में under the leadership of Professor Mohammad Umar एक प्रोग्राम लॉन्च किया, हेपेटाइटिस फ्री रावलपिंडी सिटी इनिशिएटिव का. प्रोफेसर उमर की टॉक में इसके ऊपर थोड़ा और डिटेल में बात करेंगे, पर दिस वाज अ वंडरफुल प्रोग्राम बिकॉज एज अ community living in Rawalpindi and as a university, we have to lead from the front, and we have to at least make our city hepatitis free. इसी तरह से हम ultimately पाकिस्तान को हेपेटाइटिस फ्री बना सकते हैं. तो सम अराउंड समवेयर 5% to 6% के करीब हमारे पास डेटा है कि इसमें भी मिसिंग मिलियंस में से इतना डेटा हमें आ रहा है. अभी हम जब ये सेमिनार कर रहे हैं तो तकरीबन 4000 डेथ्स आज भी हेपेटाइटिस से हो जाएंगी. सो दैट्स व्हाई नाउ द न्यू स्लोगन इज एक्ट नाउ, हेपेटाइटिस कांट वेट. We have to save lives. The problem कहाँ पे आ रहा है? 2022 हो चुका है, 2030 is the target. There are quite a huge number of challenges जो कि hepatitis care delivery system के अंदर हैं. There is no defined pathway. Patients are confused. Labs are not centralized. Physicians are overburdened. Medicines are dispensed erratically. Compliance के issues हैं. So there are a lot of issues. और Pakistan especially in issues को face कर रहा है. अब फेयर ये है कि 1988 में दुनिया ने एक कमर कसी थी अगेंस्ट पोलियो इरेडिकेशन, और दिस इज द मैप अगेंस्ट पोलियो इन 1988. 2022 में दुनिया तो पोलियो से जान छुड़ा चुकी है, बट अनफॉर्चुनेटली अगर दुनिया के मैप में कोई 2 कंट्रीज रह गई हैं तो एक पाकिस्तान और एक अफगानिस्तान. दिस इज वेरी अनफॉर्चुनेट. I am fearing कि ऐसा ही कहीं पाकिस्तान के साथ हेपेटाइटिस के केस में भी ना हो, और by 2030 ऐसा ही कुछ मैप हमें हेपेटाइटिस बी और सी में भी ना नजर आ रहा हो. So we have to act very wisely because Pakistan can't wait. जैसे मैंने कहा, इस वक्त सबसे बड़ा इशू मेरे नज़दीक, we have to find those missing millions, otherwise वो ईयरली बेसिस पे एक बर्डन इंक्रीज करते जाएंगे हमारी प्रेवलेंस के ऊपर भी, or that will be a big issue for us. So we have to act together. We have to be stronger in that way. One solution to act rapidly and to achieve our target in a minimum possible way is because we are a country of about 220 million people with 184 million cellular subscribers and 100 million 3G, 4G subscribers and 2 million using telephone. 1.4 million broadband. So हर घर में technology इस वक्त पहुंच चुकी है. So if we use technology wisely, this is one way. So I, being a part of a digital health organization, one of the leading health organizations, 𝗲𝗏4U, we have launched HepRx, which is a one-stop health solution. ताकि लोग घर बैठे न सिर्फ खुद को स्क्रीन कर सकें, बल्कि पॉजिटिव आने की सूरत में घर बैठे अपने कंसल्टेंट को दिखा सकें, प्रिस्क्राइब करा सकें ट्रीटमेंट, घर बैठे उनको ट्रीटमेंट हासिल हो जाए, घर बैठे फॉलो अप हो जाए. सो वी हैव मेड दिस 360 degree solution. This, we think that this is one aspect which can help our nation to fight against hepatitis. Every one of us has to play our role. This is our part. We are doing our job. You as a student, you as a part of society, you have to play your part. आप कैसे कर सकते हैं? You have to educate your peers. हम लोगों ने भी इसमें कुछ contribute किया. We are the authors of National Consensus Practice Guidelines under the leadership of Professor Mohammad Umar. इसके अलावा हम WGO के authors भी हैं. Raise awareness. आज की हमारी ये awareness जो campaign चल रही है, this is also a part of it. फिर collaborations, very important. Be a vocal ambassador. बात करें, जहाँ जाएं बात करें. This is very important. Be a role model, lead करें. So इस तरह से सिर्फ हम 2030 तक अपना टारगेट्स को अचीव कर सकते हैं. अदरवाइज it's like very fearful कि ऐसा ना हो कि हमारे साथ भी पोलियो वाला काम हेपेटाइटिस में भी हो. So thank you very much for your patient listening. If you have any question, I think we will be taking that at the end.
Thank you so much. Am I audible? Can anyone
Yes.
confirm if I'm audible?
Yes,
Okay,
you
sure.
are audible. Please continue.
Okay, thank you so much, Dr. Tayyab, for the wonderful presentation. Now, the next presentation was actually to be delivered by Professor Dr. Muhammad Umar, but he unfortunately had to leave on an unexpected commitment, and he is currently out of station. So he has requested Dr. Tayyab to continue his presentation as well. He will be joining us later on for the concluding remarks. So, sir, Dr. Tayyab, can you continue his presentation?
Yes, sure, why not? It will be an honor indeed, because he is my mentor, and definitely I can't fit in his shoes, but at least trying to give his message, that will be wonderful. Let me just share. Okay, so the screen is visible?
Yes, sir.
Okay, that's marvelous. So thank you very much again, once again. Of course, if it would be delivered by Professor Muhammad Umar, तो शायद ये message इससे बहुत बेहतर तरीके से deliver होता. But I will try to deliver what he was trying to say, or what his message is. Basically, it is about eradicating hepatitis in Pakistan, because he is one of the person who has really worked very hard as far as hepatitis C is concerned, and he's working on hepatitis C for the last 2 or 3 decades. He has got immense experience, so he has got a vision in that, and being a part of the higher authorities, as well as working with the authorities. So he has got this vision. So let me share with you, actually the same thing, that is in 2016, WHO has set some targets, because they have decided to eliminate hepatitis by 2030. So they have set some targets. And what were those targets? They want the countries to have 90% infants to receive a birth dose of hepatitis B virus vaccine, all blood donations to be screened for hepatitis B and C, 90% of people to have access to safe injections, 90% of people diagnosed by 2030, and 90% of eligible people treated by 2030, and 90% of those treated are cured by 2030. So these were the actually targets that were set by WHO in 2016. And the idea was that they have to eliminate hepatitis. And what by elimination, what does they mean? That they have to reduce the prevalence by less than 0.2%. And this is what our target should be in Pakistan as well. This slide may be shared by we are number 2. So this is a huge concern actually. This is another study that was shared in 2010 and actually published in 2010, and it's an estimated population. How much of the people must be carrying hepatitis B and C, and it is estimated in Pakistan about 4.25 million must be affected with hepatitis B virus, and 8.16 million would have been affected by with hepatitis C virus. Another estimation is that the new infection rate in our country is somewhere ranging between 150,000 to 240,000. So this is actually again acquired from the data we have so far. What is needed to reach WHO 2030 targets? That we have to diagnose these cases, the newly occurring cases, as well as the then we have to treat them as well. So in the initial part of this campaign, that is up to 2025, we have to do more diagnostics. Later on, the diagnostics will be low and the treatment will be more. So some 25 million individuals actually need in a year need to be screened in order to diagnose some 900,000 with Hep C positive, and amongst them some 700,000 per year need to be treated. So this is actually again a huge number. For this we have to build a capacity some 4-fold as far as treatment is concerned, and 24-fold as far as the diagnosis is concerned. The original key steps are very simple. Like you have to get a screening test done. That should be a quality testing, followed by a confirmatory test. That is currently we are usually using a PCR, but we can replace it with some other testing depending upon the best cost-effective method that can be available. Followed by a triage to target the stage of the liver disease using any method, which can be a non-invasive method, ideally. Then we have to treat it with a pan-genotypic regime, which is now easily available in Pakistan as well. And then one-step monitoring after that to check whether the patient has eliminated the virus or not. So this is a 5-step target. The problem is that Pakistan is technically an epidemic of HCV with 8 million to 11 billion individuals being affected. In this landscape, the government has recently launched its National Hepatitis Strategic Framework, which allows WHO Global Health Sector Strategy. The DAs are available with as low as some $60 per treatment course, and no formal recommendations on population-based screening in Pakistan is there. So basic issue is yet with the screening. Some large camps needs to be required. There is a large gap over there. A large investment is likely needing to scale up testing and treatment, because the current regimes that we are using cannot cope with the targets. So what is the current strategy? What is the status quo right now? The prevalence, which is around 4.9%, that is some 8.3 million, with the incidence of some 280,000 cases per year. And what we are doing is we are doing some sporadic testing based on whichever test we are available in Pakistan. Previously, we used to have the interferon regime, but after 2015, we are purely using the DAAs. Annual treatment uptake rate is currently about 160,000 per year. So this is the current status quo. और अगर हम इसी को follow करते रहते हैं और इसमें कोई improvement लेके नहीं आते, तो by 2030, there will be a decline in the viremia from 8.27 million to 7.25 million. This is only a 12% reduction. For non-viremic population में जो rise आएगा, that will be 0.41 million to 1.37 million, which is 234% increase. And there is a huge gap between these two lines. So this is actually a big dilemma. So we are not according to the right track. और अगर ऐसा ही रहा, so there will be a huge burden. 1.44 million people are projected to die of hepatitis C infection. 48% of hepatitis C related deaths would occur in people who are younger than 50 years. And this is very alarming, क्योंकि यही वो population होती है जो कि आपकी economy की backbone होती है. 1.10 million people will develop liver decompensation. और major हिस्सा ये तकरीबन 2.5 मिलियन लोगों का जो आपके इकोनॉमिक बैकबोन का पार्ट बन सकते हैं, अगर वो या either they will gonna die or they will become morbidly ill, so they will be actually putting a burden on our economy. Some 7,74,000 who are gonna be affected with hepatocellular carcinoma. So there are some very huge numbers. What is needed to reach the WHO 2030 targets? We really need to do some 25 million individuals per year in the general population screened to diagnose some 900,000 with HCV. This is how we can then treat some 700,000 people per year. Again, which I have told you that 4-fold increase करना है treatment में और 24-fold increase करना है आपने अपने screening. तो तब ये जो ग्राफ है वो इसकी जगह कुछ ऐसा बनेगा कि आप 8.27 मिलियन से इसको 99% डिक्लाइन में लेके आएंगे और 4.41 मिलियन से 7.7 मिलियन इंक्रीज करके 1790% इंक्रीज कर देंगे. So this is actually what is really required. अब डेफिनेटली इस पे कॉस्ट आएगी और कॉस्ट जो एस्टिमेशन है वो इनिशियल 2025 तक थोड़ी हायर है बिकॉज यहाँ पे आपको डायग्नोस्टिक ज़्यादा चाहिए. उसमें भी डिफरेंट ट्रियाजेस के लिए डिफरेंट कॉस्ट एस्टिमेशंस हैं. देयर इज सम डिफरेंस और उसमें आप अपने लिए बेस्ट पॉसिबल कॉस्ट इफेक्टिव टेस्टिंग टूल ढूंढ सकते हैं. लाइक जीन एक्सपर्ट के साथ जो एस्टिमेशंस निकाले गए हैं वो क्वाइट अलार्मिंगली cost effective हैं as compared to the current testing जो आप PCR यूज करें. So this is like is debatable और आप जैसे कि देख सकते हैं कि this T4 tire is the gene expert one and the T1 is actually the current testing which we are using. So 21% cost effectiveness उसकी ज़्यादा. So this is what we can do with the T4. अब इस सारे की limitation क्या है? We need a reliable estimate of the incidence of HCV which are lacking in Pakistan. We do not account for the cost associated with the strengthening the infrastructure to provide mass screening in Pakistan, and we did not account for extra hepatic benefits. जैसे कि मैंने कहा कि हमें ये भी देखना है कि आप अगर ऐसा कर लेते हैं और इन 50 years से कम लोगों को ट्रिपल होने से इनकी मोर्टेलिटी और मोर्बिडिटी को बचा देते हैं, तो ये आपकी सोशल कॉस्ट को कितना बेहतर कर लेंगे. ये सब लोग कंट्रीब्यूट कर रहे होंगे आपकी इकोनॉमी के अंदर. So this is also which we have to keep in our mind. So in summary, at least 25 million people need to be screened per year to diagnose 900,000 cases so that we can treat 7,000 patients per year. So this is very important. Ab strategies kya honi chahiye? We have to increase the availability of low cost diagnostics. We have to simplify the diagnostic and treatment algorithms. इंफ्रास्ट्रक्चर को एक्सपैंड करना पड़ेगा. जैसे मैंने भी जिक्र किया कि टेली हेल्थ एंड आपको टेक्नोलॉजी को इनकॉर्पोरेट करना पड़ेगा एंड सर्वेलेंस सिस्टम्स को और स्ट्रॉन्ग करना पड़ेगा. हमने प्रोफेसर उमर साहब की गाइडेंस में ये जो एक इनिशिएटिव लिया दैट वाज अ वंडरफुल इनिशिएटिव, हेपेटाइटिस फ्री रावलपिंडी सिटी इनिशिएटिव. 60 मंथ का ये एक प्रोजेक्ट था which has to cater the whole Rawalpindi city. पूरी UC की इसके अंदर 46 UCs हैं जिसको हमने यूनियन काउंसिल वाइज टारगेट करना शुरू किया था. मल्टीपल कैंप्स लगाए गए, उसमें अवेयरनेस कैंप्स भी थे, उसमें स्क्रीनिंग कैंप्स भी थे, फिर ट्रीटमेंट को फॉलो अप किया गया. ये उनका स्प्लिट है, हर कैंप की डिटेल है और इसमें डेफिनेटली student societies ने हमारा बहुत साथ दिया and I'm really proud of the student societies of the RNU. Under the leadership of Professor Umar and his peer, हम तकरीबन 9 कैंप्स लगाने में कामयाब हो गए. इसका टोटल समरी और इसमें तकरीबन आप देख सकते हैं कि 5.3% ऐसे पेशेंट हमने स्क्रीन कर लिए जो कि जिनको पता ही नहीं था कि उनको, और ये अभी सिर्फ एक यूनियन काउंसिल का डेटा है. और फिर अनफॉर्चुनेटली वी वर स्टक विद COVID-19 और हमें अपनी कैंपेन को रोकना पड़ा. लेकिन वी आर नाउ अगेन प्लानिंग टू रीस्टार्ट इट. In the phase 2 we will screen the remaining population now, and finally in the phase 3 inshallah all the remaining patients, and ultimately हमारा aim और हमारा idea ये है कि यही vision पूरे पाकिस्तान पे apply हो, and we can make from the vision of Professor Umar, the hepatitis free Rawalpindi, the whole idea can be extrapolated to Pakistan as a hepatitis free nation. So thank you very much for your patient listening, and over to the to you, Jawad.
Thank you so much, sir, for the thorough presentation. I must remind again that this presentation was actually to be delivered by Professor Dr. Muhammad Umar, but he had to leave for an unexpected commitment and he's currently out of station, so he couldn't deliver this. He would still be joining us shortly for the concluding remarks. And I must really thank Dr. Tayyab again for delivering the presentation on his behalf. Now, in order to, sir, we would be again taking you for the Q&A session shortly. So now I invite Iram Malik to take over and invite the next speaker. Over to you, Iram. So Iram is unable to join currently. So let me introduce the new speaker. So the next speaker we have is Professor Dr. Yasir Waheed. Dr. Yasir is working as Director, 𝗲𝗥𝗢𝗠, Office of Research, Innovation and Commercialization and at 𝗩𝗜𝗥𝗢𝗠𝗶𝗏 Medical University, Islamabad. He completed his PhD in molecular virology, hepatitis C replication from NUST and Indiana University, United States of America. He has one of the highest cumulative impact factor, more than 2,800 impact factor, and citation score. He has more than 38,000 citations. Dr. Yasir is included in the list of top 2% scientists of the world by a research study published by the principal investigator from Stanford University, USA, for 2 consecutive years, 2020 and 2021. Welcome aboard, sir, and over to you.
My slides are visible?
No, sir.
Actually, I joined from 2 systems because I think there might be some problem. So I will share slides from this. Now my slides are...
Yes, sir, they are visible now.
Bismillahirrahmanirrahim. Thank you so much for the invitation. And my presentation is on hepatitis elimination.
Sir, sorry to interrupt you, but you're
now
not
my
audible.
slides are visible?
Yes, sir. Yes, sir, they are. Just turn off the mic of one of the devices.
Can you hear me?
Yes, sir, we can.
Hello?
Yes, sir, we can hear you. You can continue. Sir, we can hear you. Your mic is working and we can see your screen. You can continue.
Can you hear me?
Yes, sir, I can hear you.
Okay. So my slides are visible?
Yes, sir, they are.
Okay. Bismillahirrahmanirrahim. My name is
Sir, turn on your camera if you haven't already.
1 minute, please.
Jawad, Yasir साहब is visible actually. He is using two different setups ना, so that's why आपको ऐसे लग रहा है. उन्होंने वो वाला setup शायद बंद किया है. इस वाले से वो clearly visible भी है, audible भी है.
Okay, sir.
Now it's visible?
Yes, sir.
May I start? Now it's okay? You can see my presentation and
Yes, just full screen करते हैं इसको, बाकी सब clear है फिर.
Bismillahirrahmanirrahim. My name is Dr. Yasir Waheed and my presentation is on hepatitis elimination. I am currently working as Director, Office of Research, Innovation and Commercialization at 𝗙𝗘𝗣𝗔𝗟 Medical University, Islamabad. So starting with the definition of elimination. So this is the definition of elimination which is given to us by WHO, that the hepatitis elimination means 90% reduction in hepatitis incidence and 65% reduction in hepatitis mortality. So the first step in the fight against hepatitis was the adoption of the first resolution on viral hepatitis by WHO in World Health Assembly in May 2010. So after that, in 2014, WHO has a second resolution on viral hepatitis, which is passed by the World Health Assembly. So these are the two resolutions which provided the base of the hepatitis elimination programs. The first World Hepatitis Day, actually in 2008, World Hepatitis Alliance started advocating for the support of the World Hepatitis Day. On 19th May 2008, first community-led Hepatitis Day was celebrated. And in July 2011, first official World Hepatitis Day was celebrated. After that, in 2015, World Health Organization and World Hepatitis Alliance jointly organized the first World Hepatitis Summit. So this was the first big event on the hepatitis, and the event was attended by 506 delegates from 84 different countries. The event provided an opportunity for governments to learn about WHO Global Hepatitis Program and directly supported the implementation of World Health Assembly resolution by providing member states representative with the necessary tools to develop the national hepatitis strategies. So this was the event in 2015. After that, different countries started developing their national hepatitis control program. So in 2016, World Health Organization has developed the first hepatitis elimination strategy. My fellow colleagues have already discussed most of the points from this elimination strategy. There were basically 8 target areas, and the essence of this strategy was to reduce the 90% hepatitis B and C incidence and 65% hepatitis B and C mortality by 2030. So in 2017, WHO and World Hepatitis Alliance has a second hepatitis summit in Brazil, and this event was attended by more than 100 countries, and theme of the World Hepatitis Summit was the implementation of the WHO Global Health Sector Strategy towards the elimination of hepatitis as a public health threat. Luckily, I was invited on both these events as a guest speaker on the first and second World Hepatitis Summit, first one in Glasgow and second one in Brazil. Next, there is a well-known campaign known as No Hep campaign. No Hep is a global movement uniting governments, medical professionals, patients, and the hepatitis community to eliminate viral hepatitis by 2030. Since its launch, No Hep has reached more than 90 million people online, and over 80,000 No Hep actions have been taken. So this is a picture of our first No Hep village, which took place at Global Hepatitis Summit in Toronto in 2018. And I was also the part of this campaign. And then I was also invited as speaker at the event launch of the campaign, Find the Missing Millions. Find the Missing Million campaign was launched at the first No Hep village at the Global Hepatitis Summit, Toronto in June 2018. So after that, in 2019, WHO conducted a consultation to evaluate the progress on hepatitis elimination targets in different regions. So in EMERO region, WHO has a meeting in December 2019 on hepatitis elimination in EMERO region, and I was also invited as a panelist on this event. So after this event, the government of Punjab has an initiative on hepatitis elimination, and that program, they are running that program at Nankana sub-district of the Lahore. Then along with WHO team, we visited the micro-elimination site at the Nankana sub and evaluated the progress on hepatitis C elimination in that specific region. So in 2019, we have a meeting by WHO, and we analyze the progress in different WHO regions on hepatitis B and C. So this is a slide from my project, Ahmed, my friend Ahmed from WHO, and the slide shows the prevalence of hepatitis B virus surface antigen in general population in different WHO regions. So in our region, Eastern Mediterranean region, you can see that the prevalence of hepatitis B is 3.3%, whereas the prevalence of hepatitis C is highest in the EMERO region. Here you can see that the prevalence of hepatitis C is 2.3% in the EMERO region. So recently, WHO has launched a new strategy, and this strategy is known as WHO Global Health Sector Strategy on HIV, viral hepatitis, and STI 2022 and to 2030. So now the new targets are set in the WHO hepatitis strategy. First target is to reduce the hepatitis B surface antigen prevalence. The baseline is as 0.94%, and the target is to reduce HBV surface antigen in children younger than 5 years old to 0.1%. Then there are targets for number of new hepatitis B infection per year and number of new infection for hepatitis C. The target for hepatitis B new infection is to reduce it from 20 per 100,000 to 2 per 100,000 infection in 2030. And for HCV infection per year, the target is, the baseline is 20 infection per 100,000 a year in 2020, and the target is in next 10 years to reduce the hepatitis C incidence to 5 per 100,000 new infections. Number of new infections in IDUs is 8 per 100, and the target is to reduce it to 2 infections per 100. Number of people who are dying from hepatitis B and C, they are still very high, 10 per 100,000 and 5 per 100,000. And the target is to reduce the hepatitis mortality to 4 per 100,000 and to 2 per 100,000. So in next, the coverage, the percentage of newborns who benefit from timely birth-dot hepatitis B vaccine and from other interventions to prevent the vertical transmission of hepatitis B. The baseline in 2020, there were 50% mother-to-child transmission of HCV, and the target is to prevent the 90% of children from mother-to-child transmission of hepatitis B. Similarly, in blood transfusions, there is a good progress around the world. 95% of blood donations are screened in the quality assured manner in 2020, and the target is to increase it to 100%, and 100% of blood donation, inshallah, will be screened to 100% by 2025 and 2030. So now I will come towards the hepatitis elimination, that what is the situation of hepatitis in Pakistan. I have a slide on health facts in Pakistan. So where we are standing in health in Pakistan. So in healthcare assess and quality index, Pakistan is ranked 154 out of 180 countries. This is our collaborative paper, which is published in Lancet in 2018. And Pakistan has the second highest burden of hepatitis C in the world. So this is a paper you can get the most authentic data on the prevalence of hepatitis B in all the countries of the world. And this is our recent paper published in just last month in Lancet Gastroenterology. Pakistan has the third highest under 5 mortality in the world. Pakistan has the second highest stunting in the children, and the top 5 units with highest diarrhea in under 5 children are located in Pakistan. So all these our collaborative work is published in the world-based journal, including Lancet and Nature. So next comes the hepatitis B in Pakistan. In Pakistan, 4 million people are living with hepatitis B virus. Only 126,000 are diagnosed and 26,000 are treated hepatitis B cases. Annual HBV deaths are 12,000 and deaths per hour is 1. Birth dose HBV vaccination is less than 1%. This is our collaborative paper, which is published in Lancet Gastroenterology in 2018. So this is the dashboard of the Polaris. You can see the progress on hepatitis B elimination target in Pakistan. So the target is to diagnose 90% of hepatitis B cases in Pakistan. And so far we have reached up to 19% of hepatitis B diagnosis in Pakistan. In case of hepatitis B treatment, the target is to treat the 80% of cases, but we have reached only nearly 10% of HBV cases are treated in Pakistan. And the progress is made in, on the targets for HBV third dose vaccination in children, but blood safety and injection safety. So these 2 targets are already achieved in Pakistan and in most of the countries of the world. So this dashboard is showing that the targets which are present for hepatitis B elimination in WHO hepatitis elimination strategy, and whether with current pace we are on the track to achieve these targets. So the first target is to achieve the 90% HBV diagnosis rate by 2030, but by 2040, maybe we will reach to, maybe we will attain this target of 90% HBV diagnosis. To achieve 80% HBV treatment, we are not on track, and we will not by 2050, we will achieve this target. And to achieve the 65% mortality in HBV, it is also like impossible to achieve this target by 2030 with current efforts. Similarly, this is the scenario of hepatitis C in Pakistan. So this is the most authentic data on the prevalence of hepatitis C in Pakistan. And this is our collaborative paper, which is published in Lancet Gastroenterology in 2022. The prevalence of HCV in Pakistan is nearly 3%, and there are about 7.39 million people living with hepatitis C in the Pakistan. 27% are the diagnosed cases, annual treatment rate is 1%, annual deaths are 27,000, and the deaths per hour for hepatitis C in Pakistan are 3. So this is the dashboard for the progress on hepatitis C elimination target in Pakistan. For HCV diagnosis, we reach about 29% of HCV cases in Pakistan are diagnosed, and close to 20% are treated. We have already achieved the target for blood safety and injection safety. And if we look at the targets which are set in the WHO hepatitis elimination strategy for hepatitis C, so by 2050, we are not on track to achieve the targets for HCV diagnosis, treatment, to reduce the mortality, and to reduce the HCV incidence in Pakistan. So this slide is showing that if the countries will work on hepatitis elimination strategy for WHO, what will happen, and if they will not work on the strategies, then what will happen to the hepatitis B and C incidence and death rate. So you can see that in 2020, there were about 1.5 million cases of hepatitis B virus. If countries will work on hepatitis elimination strategy, this target, the target of 170,000 of hepatitis B infection will be achieved. Otherwise, if the countries will go with the current pace, the incidence of hepatitis will decrease to 1 million in new infection per year. Similarly, in case of HBV deaths, we are currently standing at 20,000 deaths per year in 2020. If countries will work on the strategy, the deaths will also reduce to 310 deaths per year. In case of HCV, there are about 1.5 million infection per year. If the countries will work on WHO strategy, this will reduce to 350,000 infection, and deaths will also reduce from 290,000 to 140,000 by 2030. So these targets will only achieve if countries will start actively working on WHO viral hepatitis strategy. So the major hurdle in the fight against hepatitis is the financing. Hepatitis elimination needs an annual funding of $6 billion from now to 2030. So every year, globally, $6 billion are required to achieve hepatitis elimination targets. No major donor committed funding in the fight against hepatitis. And whereas in between 2000 and 2019, approximately $170 billion are spent in the fight against HIV and AIDS. And due to this amount of funding, the HCV deaths are decreased from 1.6 million per year in 2000 to 864,000 in 2019. So these two are from our studies which are published recently, one in WJG and second is in Lancet HIV. So Gilead is a research-based pharmaceutical company focused on discovery, development, and commercialization of innovative medicine. Gilead has only invested $50 million for hepatitis elimination project, whereas EndHep 2030 has a target to achieve hepatitis elimination, and they have committed a funding of $4.2 million. So hepatitis elimination cannot be achieved alone by the government effort. There is a need to engage all stakeholders in the fight against hepatitis, including health ministries, professionals, medical societies, academia, pharmaceutical companies, civil society around the globe. So after this, I'm showing our work on hepatitis, which are doing since last decade in Pakistan. So this was my first paper on hepatitis C in Pakistan. This is the most authentic data on the prevalence of hepatitis C virus in Pakistan and different high and low risk population group. And this paper is published in World Journal of Gastroenterology, and this paper has earned more than 300 citations. Then we have conducted an evaluation study to see which hepatitis C rapid test kit is showing good result, which can be used for the screening of hepatitis C virus on mass scale. So we have compared the 3 marketed competitor hepatitis C virus rapid kits which are available in Pakistan. And we have studied this, the 3 kits, Intech product, SG Bioline, and CTK has showed very good result for the screening of hepatitis C in Pakistan. We have conducted a study on familial clustering of HCV in Pakistani population, and we have observed that 30% of the cases have the familial link clustering of hepatitis C in Pakistan. If one person have hepatitis C, 30% of chances that the other family member will also get hepatitis C, because in Pakistan, people are living in small houses and the number of people living in one house are very high as compared with the Western world. We have published a lot of data on hepatitis B, pegylated interferon, and phylogenetic analysis and molecular biology. And then in 2018, we published sofosbuvir and ribavirin therapy response in PeerJ. And on hepatitis elimination, I have published number of papers. Most of them are as single and first author, like this one in World Journal of Gastroenterology and Hepatitis C eradication. Then when hepatitis C is included in the Sustainable Development Goal, I publish an article on, and then this article, hepatitis elimination by 2030, this article already got 70 citation, and it's also published in World Journal of Gastroenterology. Then we publish on hepatitis elimination in Pakistan, progress on elimination. So recently I published, like in December, I have published what progress so far have been made on hepatitis elimination. And this is published in World Journal of Gastroenterology. And because there is no drug currently present for the treatment of hepatitis B, I got a research grant to find new drugs for hepatitis B virus. So recently, this paper is published in Journal of Molecular Modeling in 2022. And in this study, we try to find out new drugs for hepatitis B. So this paper is also published on molecules on new drugs for hepatitis B. So this paper is not on hepatitis, but it's on COVID. The first peer-reviewed article on Omicron was from our research group, and we have studied what are the changes in the Omicron variant in the spike protein and how they are affecting binding with the host receptors and evasion from the antibodies which are produced from different vaccines. So over this paper already got very high citations. So these are few slides of our social work we conducted. My student have screened different population groups, including refugees, transgender population, pregnant women, thalassemia population, blood donors. And then this is the slide from the World Hepatitis Summit from Brazil. And this is the slide which is showing my hepatitis awareness program we conducted in Pakistan. And this picture is from hepatitis awareness and screening in people who inject drugs. And this picture is by the CEO of World Hepatitis Alliance, Kerry James, sharing my statement on hepatitis elimination. And this was the meeting on hepatitis-free Pakistan at Serena Hotel in July 2019, and jointly conducted by World Health Organization, Aga Khan, and Ministry of Health. And they have pasted my quote that no initiative is small. We need many small. We need many people doing small initiative for elimination of hepatitis in their communities. So the key to success is you solve the work hard, stay positive, and collaboration. Thank you.
Thank you so much, Dr. Yasir, for the thorough presentation. Before moving to the Q&A session, we would be joined by Professor Dr. Muhammad Umar for his concluding remarks. So he would be joining us shortly, and we would have to wait a bit before he joins us, because he just confirmed that he will be joining very soon.
In the meantime, the attendees are requested to kindly share their questions in the chat, and we are inshallah looking at all your questions and noting them down. So kindly, we have listened to 3 presentations now, and if you have any questions in your mind that arose, you can share your questions with us on the chat, so that we will be incorporating them inshallah and trying our best to answer all of them in our question and answer session.
Okay, so we have decided to move on to the Q&A session. And as soon as Mr. Sir joins us, we will just ask him to give his concluding remarks. So, sir, can we start our Q&A session? Dr. Tayyab?
Yes, sure, please.
Okay. Dr. Javeria, are you here?
Yes, I am.
Recording
Sir is here. So my first question is from Dr. Javeria Khan. This is, what is the relationship between hepatitis B and hepatitis B, hepatitis B and hepatitis D, and why do they mostly occur synergistically?
Yeah, actually, hepatitis D virus is a defective RNA virus, and it needs hepatitis B virus for its replication and viron assembly. It can never occur alone. If it occurs, it can either occur as a co-infection or a super-infection, but it can't occur at its own.
Okay. So, Dr. Tayyab, the next question is to you. What is the best treatment for DCLD with ascites?
Thank you. Actually, when we talk about DCLD, so it's a decompensated chronic liver disease. That is the liver, which is actually trying to fight against this chronic deadly disease, has lost the fight and now is decompensated. So there are several features of decompensations. One of them that usually presents at the very beginning is ascites, it is managed through several ways, starting from the lifestyle modification to the medical therapy, and finally the interventions, and then leading to the liver transplant. So the simple lifestyle modifications include salt restriction, and then we can put the patient on some diuretics. We can build the diuretics to the maximum dose, but if patient do not respond to the diuretics, this actually needs a consideration for the liver transplant as well.
Okay, so sir, the next question is also to you. Why do the barbers in people living in low sanitary places get hepatitis even they don't take much precautions? Oh, this question doesn't make sense, I guess. So
I think so. The message is that if they don't take precautions, they are at higher risk. And the take-home message for them is that they, as I said in my presentation as well, that just spend about like 1,000 or 1,500 bucks and purchase your own kit, a scissor and the shaving stuff, and always carry it with you to the barber. And that is the simple way to get yourself protected.
Okay. So the next question is to Dr. Yasir. The question is, how long will it take to discover the cure for HPV carrier? Are there any recent studies for that?
A number of research groups are working on finding new inhibitors for hepatitis B, but finding a new drug is a very long process. The target in hepatitis elimination are very limited. Like we have now 8 years left in 2030 to go towards the hepatitis elimination targets. But finding a new drug, it takes many years. So it will take time.
Hamza?
Okay, inshallah, I'll move to the next question. So the next question is also to Dr. Yasir, and is it in regards to how hepatitis B, the current research is regarding its cure, final cure. So the questioners are asking how far has research progressed now to finding a hepatitis B specific cure?
It's the same question. It will take time because drug development is a very long process. So the first step, like I have a very good research group who is working on finding new inhibitors. So we performed different. There are different inhibitor libraries which are present online. We use JET libraries, and we perform binding of that drugs with hepatitis B virus proteins, like with the polymerase and with the protease protein, and then we have some entry inhibitors. So this is the first step of finding a new drug against any disease. So the next step is to take that drug into a cell line based system, and then animal model, and then human trial, and safety measures, and limited human trial, and then phase 1, 2, 3. It take years to find a new drug.
Okay, sir, thank you for that detailed answer. Moving on to the next question. This is to Dr. Tayyab. And the question is, how would you recommend asymptomatic patients or patients who are seemingly healthy be screened for hepatitis? Should everyone now currently live in, should they follow a particular hepatitis screening pattern, or is specialized hepatitis screening only important for example, healthcare workers that work with needles, for example, or is this applicable to everyone? What should the common man do?
Actually, it's a very good question, because technically the screening is for the high risk. But if you just look at the stats, like Pakistan, which is actually, it's an epidemic for hepatitis C, and the rates of hepatitis B, the prevalence and the incidence is also quite alarming. So I think so over here, at least once every person should be screened for hepatitis B and C, because we, being a Pakistani, are a high risk population. So we should be screened at least once.
Okay, the next question we have is to Dr. Javeria, and this is regards to the vaccination of hepatitis. So a question is being asked, if we have gotten 3 doses of the hepatitis vaccine and we do not get a booster dose, so is this going to be detrimental to our health? Will this lead to increased chance of getting hepatitis? So basically participants are asking what is the importance of this 3rd booster dose that we get?
We have, as per the vaccination protocol, we have 3 doses at 0, 1, and 6 months. If after the 6 months duration, after the 3rd dose is given, we need to get the anti-HPS levels. If the anti-HPS levels are greater than 10 milli-international units per liter, then there is no need for any booster dose, even after 5 years. People usually come to our clinics for the booster dose, and who are already vaccinated against hepatitis B. If their anti-HPS levels are greater than 10 milli-international units per liter, we don't go for a booster dose. But if they are less, yes, we go for a booster dose.
Well, thank you for that detailed answer. Moving forward, this is a question to all the panelists. Obviously, all the panelists here are associated with the healthcare industry. And so this kind of situation does occur in people wherein they might be hepatitis B positive working in the healthcare industry. So for such people, especially doctors, what should be their ideal point moving forward? How should they deal with this situation if they do come out to be Hep B positive? How should they report it? How should they deal with it? And will this have a great effect in their future career? Obviously, being healthcare providers, having hepatitis B can be obviously a detriment. So the question was in this regard. So how should doctors who might have been tested positive for Hep B, how should they deal with it?
If they are
Yes, I think so, Dr. Javeria, you can.
If they are positive and they fulfill the criteria of getting the medication, then they should get the medication. If they don't fulfill the criteria, then we have to follow up them at 3 monthly or at least 6 monthly duration. In regards with patients who don't fulfill the criteria, and if their viral load is greater than 1,000 at least international units per ml, then we at least ask them to not to go for any procedure related task, because it not only makes them more vulnerable, but they also makes the patients or other staff more vulnerable to get the infection.
So I think the first thing I would be adding in it, that a very pertinent answer by Dr. Javeria, but what I want to add is that first of all, they should not get depressed, because being HPS AG positive or being affected by hepatitis B doesn't mean an end of life, because people are affected with several other diseases as well, and they have to modify their lifestyle accordingly. So being a medical professionalist, there is a big variety. You can opt this profession in a number of ways. So you can modify your approach. You can, like as Javeria have said, that it is not necessary that you should have to be a surgeon or you have to be a person who has to perform a invasive procedure always, but you can serve the community in a number of different ways. So don't get depressed, or don't get the things to be on your mind or on your nerves. Just get yourself treated according to the guidelines and serve the community in a different way.
Yes, and it should not be the stigma. People take it as a stigma. Okay? And like they don't know how this virus gets transmitted from one to other person. And like अक्सर हमारे पास जो OPD में पेशेंट्स आते हैं वो आइसोलेट कर देते हैं पेशेंट को, हमें इसके साथ खाना नहीं खाना, हमें बैठना नहीं है, हमने ये चीज़ अलग कर दी, हमने वो चीज़ अलग कर दी है, ये सब चीज़ें इट्स नॉट रिलेटेड विद हेपेटाइटिस बी एंड सी. ठीक है, दे शुड नो, दे शुड स्प्रेड द वर्ड कि ये फैलता कैसे है. अदरवाइज जिस पेशेंट को होता है वो ही टेक्स इट एज अ स्टिग्मा, शायद मेरे साथ पता नहीं क्या हो गया, शायद मेरे पास जीने का हक ही नहीं है. We see many of such patients in our OPD.
Okay.
It shouldn't be like that.
So Dr. Umar is here, Professor Dr. Muhammad Umar. Let me, sir, Can you hear us?
Yes, I can hear you. I can hear you. Can you hear me, please?
Yes, sir, you're very audible.
Oh, great. That's excellent.
So, okay, so let me introduce Professor Dr. Mohammad Umar. Professor Dr. Mohammad Umar 𝗍𝗏𝗡𝗅. He is currently working as the Vice Chancellor of Rawalpindi Medical University. He is also a consultant gastroenterologist and hepatologist. He is also the staff in charge of Medicos Aid Society. Sir, over to you for the concluding remarks.
Bismillah ar-Rahman ar-Rahim. It is indeed great pleasure and honor to join this webinar. And I congratulate all the office bearer, and I also congratulate all the speaker and panelists, and particularly Dr. Javeria, who just replaced me because I have to come to Lahore for an urgent meeting. I think this is excellent activity, and this mission should be carried on in the future also. And my heartfelt congratulations once again, because hepatitis is killing so many people, not only in Pakistan but globally. And unfortunately, we are second on the world number to have maximum number of the hepatitis C patient. And the only message I want to give is that this disease is, 100% preventable. When people die of a preventable cause, I understand that the responsibility lies on the healthcare professional and the government. I hope, inshallah, with the future strategy and national hepatitis prevention and control programs, we will, inshallah, able to control this menace, and inshallah, we are heading toward from cure to elimination. I think our objective should be to eliminate hepatitis C, the target which has given by the WHO's 2030, and we should all work together to get rid of this hepatitis C, which is the major killer and major reason of liver transplant and hepatocellular cell carcinoma. Once again, I'm thankful to all the speakers and the participants and the panelists, and I'm also grateful the invitation extended to me by your side. My best wishes and thank you very much.
Thank you so much, sir, for taking time out of your busy schedule. Thank you so much.
Thank you.
Hello.
Dr. 𝗍𝗏𝗡𝗅, you can take a few more questions and then we can conclude.
Yes, ma'am. So the next question is that from Dr. Javeria. Can a patient of asthma get vaccination?
Yes, you can. Surely you can.
And what are the side effects of hepatitis vaccine?
There are no as such side effects apart from feverish or fluish feeling. Otherwise, there are no major side effects of hepatitis vaccine, and you can easily and safely get it.
Okay. So, ma'am, the next question is, how reliable is kit method for testing hepatitis B and C?
I think Professor Yasir has clearly mentioned this thing in his presentation. By kit method, we mean a rapid detection test, and it has a sensitivity and specificity of approximately 99 to 100%. So we can easily rule in and rule out the disease. Once a rapid detection test gets positive, we have to reconfirm it via ELISA, and then after it gets confirmed, we have to get the PCR done for viral load.
Okay, ma'am. So the next question is from Dr. Yasir. Can hepatitis reappear once it gets treated? If yes, what are the possible chances?
Sorry, I couldn't hear you. Can
hepatitis reappear once it has gotten treated? If yes, what are the possible chances?
Again, I could not.
Sir, can hepatitis reappear once it has gotten treated?
You are talking about hepatitis B or
actually,
C?
I cannot answer this question. I'm not a clinician.
Okay.
So
sir,
I can only answer.
You can answer it, or otherwise by my way.
Okay, actually, you have to be specific, like we're talking about hepatitis B or C, because now with the new DAAs, hepatitis C, the eradication rates are very good, especially the new pan-genotypic drugs. We have got a SVR rate of nearly about more than 90%, and even few of the DAAs have got the SVR rate reaching up to 100%. So that's very good. But when it comes to hepatitis B, the situation is not very good over there. But the story is quite different as far as hepatitis B is concerned, because 90% of the cases over there don't even need the treatment. They only need close monitoring. The 10% of the population that need treatment, we too able to have a good, viral load suppression, but getting eradication of hepatitis surface antigen it's very rare. Like it's nearly up to 0%. So the story is different for the two viruses.
And what, sir, the next question is, what are the appropriate steps that should be taken after prick from a positive patient?
I have discussed that in detail in my presentation as well, that first of all, don't panic. Second of all, do the first aid. Third, then you have to, first you have to know that from which patient you have been pricked, like was it Hep B or Hep C? If it was Hep B, you have to know what's the status of the person who has been pricked. Like the patient has been vaccinated, and what about the titers of the vaccination? It's more than 10 international units or not. If it's more than that, there's nothing to worry, you don't need to do anything. But if you're not vaccinated or you don't have the required titers, then you have to get the immunoglobulins followed by the vaccination done. As far as Hep C is concerned, unfortunately, we don't have any immunoglobulins or vaccination over there. So over there, you have to get a baseline of your own status, and then you have to get yourself checked after 4 to 6 weeks with a PCR, or after 4 to 6 months with a serology, whatever method you want to know. And if it comes out to be positive, then you have to treat it. That's the simple way.
Over to you, Hamza.
Okay, we will inshallah be taking a few more questions, and we will inshallah then take our speakers' views and feedback regarding the webinar. So the next question is to Dr. Yasir, which is how reliable are the rapid diagnosis testing kits? Like, for example, you have stated that you had studied about these. So how reliable are these kits? Because some of the participants are saying they have had experiences wherein the rapid antigen test might have given a false result. So currently, as it stands, how accurate are these tests? Or should we move towards a PCR test to confirm diagnosis?
Actually, Pakistan have a very high burden of hepatitis B and C virus. We have conducted a study which is sponsored by a foreign company, and we evaluated 3 best hepatitis C diagnostic tests in Pakistan, and they are performing very good result. They have like sensitivity of more than 97%. But if you overall compare the Pakistani market, and there are like 50 hepatitis C rapid tests, so maybe out of that 50, 5 to 10 are very good tests from reliable companies. So there are in market both like good and bad, both kind of tests are available. It's up to you. So that study is already published, and it shows that the 3 best market competitors are showing very good result, and they can be used for screening of hepatitis C on mass scale.
Okay, thank you, sir, for the answer. Moving onwards, the next question that we have is once again to you, Dr. Yasir, and this is in regards to family clustering, especially in hepatitis C. So participants are asking, had you found the possible reasons for such a finding in hepatitis C patients, that family clusters were being discovered? So did you find any particular reason for this, particularly in Pakistan?
Actually, in that study, we just analyze the familial clustering, but we perform other studies, and we have seen that there are so many things that in Pakistan, people like एक घर में इतने सारे लोग हैं और वो कॉमन पेस्ट सब लोग एक सोर्स, अगर हम सिर्फ टूथपेस्ट ही देख ले तो वो ऐसा कॉमन सोर्स है, किसी को ब्लीडिंग है, सब एक ही पेस्ट को यूज कर रहे हैं, नेल कटर और डिफरेंट घर में ऐसी चीजें हैं जो कि सब लोग ही यूज कर रहे हैं. एक पॉजिटिव है तो उससे चांसेस हैं कि बाकी लोग भी पॉजिटिव हो जाते हैं. तो बहुत सारी चीजें हैं जिनको अगर स्टडी किया जाए तो आपको छोटी छोटी सी चीजें मिलेंगी जहां से एक बंदे से बाकी लोग भी पॉजिटिव हो सकते हैं. लेकिन क्लस्टरिंग 30% हमें मिला HCV का पाकिस्तानी पॉपुलेशन.
Sir, thank you for that answer as well. Moving forward, the next question is on more of a social level, once again open to all the panelists. This is in regards to social relationships and specifically marriage in patients who are Hep B, Hep C positive. And this has been found to be an issue wherein people who are in this stage feel it hard to express to potential future spouses their current hepatitis status. So what is the guidance in this regard for such people? And can someone with a lower viral load, can they have safely have children, or is this not recommended? So this is open to all the panelists, so they could kindly answer.
So for hepatitis C is now, you can see that the good drugs are available for hepatitis C, and it is curable in few months. For HBV treatment is, its treatment is long and it takes time that you reach a level where the virus is not detectable. So I have seen many families in which it's not transmitted. Virus is not transmitted from the spouse, from husband to wife or wife to husband. But I do not have a solid research paper to support my argument that this is the exact percentage of like hepatitis transmission in like marital couples.
Yes, Dr. Yasir has rightly said that we don't have a research paper on this, but actually the side is not that darker the way it looks like. But as we are practicing physicians and we come across the real life stories, let me tell you, this is such a big stigma. And once someone is labeled with either hepatitis B or C in premarital, it's such a big issue in our society. Technically speaking, people hide it. If they tell before marriage to the partners, the marriage is simply impossible, let me tell you. On the other hand, technically speaking, as far as hepatitis B is concerned, by simple vaccinating the partner, you can eliminate the chances of spread. Similarly, some very good counseling and some very good intranatal and perinatal monitoring and timely injecting the interferons and the immunoglobulins and all those things, you can easily prevent the vertical transmission as well. As far as hepatitis C is concerned, now it's not a dilemma at all because of the new era as we have entered the BAAs. So that is not a threat at all. But the name itself is such a big stigma that, believe you me, if someone tells before marriage, the marriage is impossible. So this is a big issue in our society.
Thank you, sir, for a very detailed answer. Yes, Dr.
Yeah, I am agree with Dr. Saab. Actually, मेरे कहने का मकसद ये है कि मैंने जितना भी काम प्रेजेंट करा वो सारा मेरा अपना है, और वो बात जिस पे कोई चीज मैंने पढ़ी हो या खुद पब्लिश की हो तो मैं उसको बिल्कुल 100% कह सकता हूँ, और वैसे आइडिया सिर्फ गेस है, और आप लोग क्योंकि एक्चुअली प्रैक्टिसिंग फिजिशियन है तो आप लोग बेहतर बता सकते हैं। डॉक्टर साहब ने बिल्कुल ठीक कहा।
Thank you, sir, for your remarks. Now, moving on to our last question for the day, and this is obviously in regards to every one of our speakers here being leaders in the fight against hepatitis and properly involved in the research aspect as well. So the next question is, can you highlight any areas in hepatitis research that still need to be filled? Any knowledge gaps that you have seen during your research or during your practical experience that you feel requires more research for the potential researchers present here today as well and future doctors?
This question for me?
Yes, this to all our panelists. So you can start, Dr. Yasir, please.
Actually, currently hepatitis C का तो बहुत अच्छा ट्रीटमेंट मौजूद है मार्केट में, और अगर ओवरऑल हम मार्केट में देखें तो HCV पे अब रिसर्च थोड़ी कम हो रही है क्योंकि बहुत अच्छी ड्रग्स अवेलेबल हैं, पेन जीनोटाइपिक है, कोई इतने साइड इफेक्ट्स भी उनके आ नहीं रहे, लेकिन कॉम्प्लिकेशंस और बहुत सारी चीजें हैं जिन पे क्लिनिकल स्टडीज भी की जा सकती हैं। हेपेटाइटिस बी ड्रग डेवलपमेंट बहुत बड़ा इशू है, बहुत सारा काम अभी बाकी है और मुश्किल रोड है हेपेटाइटिस बी के लिए एक नई ड्रग का दरियाफ्त करना। इस पे अभी हम लोगों ने, हमारी जो कंप्यूटेशनल टीम है, हमने कोशिश की है, लेकिन इतना आसान नहीं है एक ड्रग को फाइंड करना और उसको एंड स्टेज तक लेके जाना। एक बहुत बहुत कह लें कि लंबी रोड है, उस पे से गुजरना पड़ता है। तो एवेन्यूज है, सोशल साइंस के बहुत सारी चीजें हैं जिन पे काम किया जा सकता है। अच्छे आपके पास सुपरवाइजर हैं, फैकल्टी मेंबर्स हैं और ये जूनियर्स को बहुत अच्छा काम करवा सकते हैं इसमें।
Thank you, sir, for that answer. Dr. Tayyab.
I must just contribute. And first of all, I must congratulate Dr. Yasir for such tremendous work in the field of hepatitis in Pakistan, and some very good publications in Lancet. And definitely, I would love to read them as well. I agree that hepatitis C, it seems to be a past story now as far as international research world is concerned, because of the best years we have. I think the similar is the case with hepatitis B. Agree that we don't have some very good treatment for B, but because of the vaccination and some very good campaigns and the compulsory vaccination of the newborns and all those things, I think so hepatitis B will also soon be history. What I think so, the new hot research topic that will going to be replacing the liver diseases and the etiology of chronic liver disease and the new threat, 𝗙𝗤𝗢𝗔𝗟 jo hoga, that will be the NASH, the fatty liver. Because of our sedentary lifestyle, because of the upcoming diabetes and the increasing incidence and the prevalence of the diabetes in the society, more than 50% of the population is now being affected by diabetes. So the NASH, I think so, is a hot topic that we should be concentrating upon.
I second Dr. Tayyab on this. Non-alcoholic fatty liver disease is now the area for research, and now after hepatitis B and C, it's the most dominant hepatitis we have in Pakistan even. And in if we talk about abroad and Western countries, this is NASH is like anything, and they are working on it for the past, I think, 20 plus years, and now it is one of the dominant cause of hepatitis even in Pakistan. So a big area of research is here in this aspect.
Okay, so now I would be inviting Dr. Yasir. First of all, this ends the Q&A session. And Dr. Yasir, I invite you to give your review remarks on our webinar today and give us any feedback. How can we do better next time?
जी बहुत शुक्रिया, लोगों ने बहुत अच्छा वेबिनार ऑर्गेनाइज करवाया और ऐसे इवेंट्स जरूर होने चाहिए ताकि पता चले कि जो मुख्तलिफ चीज़ें, जैसे हेपेटाइटिस जे आया तो हेपेटाइटिस की सिचुएशन क्या है, ट्रीटमेंट क्या है, और मेरा ख्याल ये है कि अभी तक तो हमारी ऑडियंस मेडिकल और मेडिकल के स्टूडेंट हैं। अगर थोड़ा एक्सटेंड किया जाए और आपकी सोसाइटी से ही कुछ लोग मार्केट में भी अवेयरनेस की कैंपेन्स वगैरह अगर आप इसी सोसाइटी से करें तो मेरा ख्याल है ये चीज़ें और ज़्यादा बेहतर हैं, इनकी ज़रूरत है। और मेरे पास कुछ लिमिटेड स्टूडेंट्स हैं, हमने थोड़ी बहुत कोशिश की कि हम जनरल पॉपुलेशन को भी थोड़ा बहुत बताएं कि हेपेटाइटिस से कैसे बचना है और हाई रिस्क पॉपुलेशन को भी। और मैं यही चाहूँगा कि बहुत अच्छा इनिशिएटिव है, इस तरह के इनिशिएटिव दोबारा भी किए जाएं। बस थोड़ा सा मेरे सिस्टम के साथ प्रॉब्लम होगी जब मैं प्रेजेंट करने लगा, क्योंकि मेरे पास ड्रग डेवलपमेंट के सॉफ्टवेयर दोनों पीसीज पे चल रहे हैं तो वो अक्सर स्टक कर जाते हैं। आज भी जब मैंने प्रेजेंट किया तो मुझे लग रहा था कि शायद मेरा सिस्टम नहीं चल रहा, तो थोड़ा उसके लिए मैं चाहूंगा कि थोड़ा सा बीच में इनकन्वीनियंस हुई, लेकिन इंशाल्लाह नेक्स्ट टाइम हम इससे भी बेहतर जो है आपके साथ कोशिश करेंगे। बल्कि नेक्स्ट, शुक्रिया।
Thank you so much, sir, for agreeing to speak today. Dr. Tayyab, would you be giving your review remarks?
Thank you very much. And again, thank you indeed for arranging such a nice webinar and inviting me for this. Hepatitis, definitely it's a big issue. And as highlighted by Dr. Yasir as well, that and the same is my fear is as well, that I don't think so that if we move with the same pace, we will be able to eliminate it by 2030. And he has pointed out in a very good scientific way that it may last to about 2042 or something even beyond that. So we have to expedite the things, and I think so. Two things are very important to me. One is the collaborations. The you people, you have to come forward. You have to be the forefront. And second, the technology. I think so. We have to incorporate technology, the digitalization, the telehealth. That has to be incorporated in this whole fight against hepatitis. Otherwise, it will be very difficult. I am really pleased to be connected to Dr. Yasir, and I am looking forward now for some really good joint ventures. Dr. Yasir, we are currently working on the updated national consensus guidelines as well. And we are also gathering data for even we have written some 1 or 2 chapters working on some meta-analysis right now. And we are looking forward for some joint ventures, I think so we can do. It's really, I'm delighted to be connected to you for some future ventures. Thank you very much.
Dr. Javeria?
और मैं
Okay.
सर उमर से मीटिंग्स हुई कुछ आप लोगों के पास भी मैं चला कोशिश करूंगा आए हम कुछ लाइक अभी मैं काम कर रहा हूँ एज ए डायरेक्टर और मेरा काम है कि पिम्स आप लोगों को प्रमोट करूं कि हमारे लोग ग्रांट राइटिंग की तरफ जाएं मिल के ज्वाइंट प्रोजेक्ट्स जो है हम लोग अप्लाई करें उसमें भी आप लोग हमारे साथ देखें जो भी ज्वाइंट प्रोजेक्ट SHEC है वो कहता है कि आपने ऐसा ग्रुप अप्लाई करना है मुख्तलिफ यूनिवर्सिटीज इंडस्ट्रीज मिलके ग्रांट अप्लाई करनी है कहाँ पे आपको जरूरत पड़े पिम्स में लोगों को ऐड करना है हमें इन्वॉल्व करना है आप जरूर बताएं ज्वाइंट प्रोजेक्ट रिसर्च ग्रांट जो भी है हम लोग बहुत सारे काम मिलके कर सकते हैं
इंशाल्लाह looking forward.
Dr. Javeria?
Thank you so much for inviting us, and well done Medicos Aid Society for this such an elaborative and informative webinar with our mission कि hepatitis अब और नहीं. I need to emphasize that we need to get ourselves vaccinated and we need to spread this word. Thank you so much. And Dr. Tayyab ने कहा Dr. Professor Yasir के साथ हम चाहेंगे कि हम कुछ रिसर्च प्रोजेक्ट करें और जिस सर आप ऑरिक के डायरेक्टर हैं तो हमारी ऑरिक भी है वी कैन इजीली कोलैबोरेट थ्रू प्रॉपर चैनल और हम जो हमारी अंडर ग्रेड्स हैं उनको भी लेके चले तो ऑब्वियसली ये ज़्यादा बेहतर होगा जिस हमारे हैं उमर है और जवाद है हमजा है सारे अंडर ग्रेड्स हैं इनको सब लेके चलें ताकि इनकी रिसर्च का एक रुझान हो. Thank you so much for everything.
I would personally like to thank all of the speakers because I was communicating with all of them separately. So I would personally like to thank all of you guys for taking the time out to conduct this webinar. Over to you, Iram.
I would like to invite President of MAS, 𝗪𝗏 to share a few closing remarks with us.
Am I audible?
Yes, you are audible.
Honorable panelists for their wonderful presentations and answering our questions extensively. As discussed, hepatitis is a very prevalent condition in Pakistan and need to be addressed on priority basis. I hope the session was very informative and every question were covered. Now, as citizens of Pakistan, it is our duty to spread awareness. Our main goal is not just to treat hepatitis, but to prevent, rather eliminate hepatitis from society, so that we can make Pakistan hepatitis free. I'm very thankful to worthy speakers, Dr. Tayyab, Saeed, Dr. Javeria, Dr. Yasir, and especially Professor Dr. Muhammad Umar. He was very supportive and very kind. Even being out of session, he still added his remarks. I'm very thankful to all of you. Thank you so much for joining us and giving your precious time to us. And lastly, I would congratulate the whole team for arranging such a informative webinar. Congratulations, everyone. Suggestions of our worthy panelists are very important to us. Inshallah, we will try to have such a more webinars. And thank you so much, everyone.
Thank you, President. I would like to thank all the speakers who have taken time and shared such an informative and an important webinar on hepatitis with us. And I would also like to thank all the participants who have watched this webinar on YouTube. A message to the participants: don't leave your WhatsApp groups. We will be sharing your e-certificates on these groups. Thank you.
One last message for all the participants who are viewing. You can all find the feedback form in the YouTube live stream chat. So you are all requested to kindly fill the form and give us your valuable feedback regarding how we can further improve our webinar sessions in the future. So all participants who are currently watching the live stream are all requested to kindly fill in the feedback form, the link of which is pinned in the YouTube live stream comments. Thank you, everyone.